Okay, your turn. So here's a lesion on a mammogram. How would you describe this? What's the first thing you're going to say about it? Left breast. Yep, which breast is it in? Left breast. Okay. There are calcifications. There's a spiculated, I think you could say mass lesion, spiculated mass lesion.
Upper and lower quadrants.
So, yeah, it's definitely, on the CC, it's definitely where? Lateral. And on the MLO view, I think the nipple is here. So it looks maybe a little more in the superior than the inferior, but, you know, I would call this left upper outer quadrant, or maybe 2 to 3 o'clock position, because 3 o'clock would be exactly lateral and 2 would be just a little bit above that. But so I'd say spiculated mass in the left breast, 2 to 3 o'clock position. We don't have measurement markers on here, but it's probably approximately 3 centimeters in size with associated malignant calcifications. I can tell you these other big round calcifications, these are benign calcifications. So those would not be suspicious. Okay, this patient presented with a palpable mass in the right subareolar area, and that's pretty much what you see on the mammographic finding as well. This bright white dot is a skin marker that is put on the skin before the patient goes to get the mammogram to see, you know, does the mammographic, you know, finding correlate with the location of where this was felt. Okay, there we go. Okay, how about this one? So let's start off. Which breast? So these are not all optimally labeled, I think just because they got cut off. But I can tell you this is laid out in the standard view. So what breast do you see a lesion in? Left. Do you see the skin BB? The skin marker? Bright white dot on the skin. This thing right here. Okay. And on this view, it's right here. Okay, so left breast, what quadrant would we say this is in? Lateral is not quite a quadrant. Upper outer, right? So upper outer quadrant, and how would you describe this finding? Rounded, mass lesion, and we would estimate it, let's say a centimeter. But once you're in Q-reads, you can actually measure things and it will give you the size. Yeah. Yeah, what do you think about these calcifications? They're blood vessels. These are vascular calcifications. This is an old lady with heart disease.
What o'clock would you call that?
I would call that 2 o'clock.
Okay.
Yeah. So it's definitely lateral, and here's her nipple. So on the MLO view, it's a bit superior. So I'd call it 2 o'clock.
For upper outer, it's left breast, would that switch the clock then to?
If it were in the right breast, then it would be 10 o'clock. So yes, okay. There can be some dyslexic challenges with the o'clock position changing from one breast to the other, and so sometimes for that reason you just say upper outer quadrant, you know, and don't have to get confused that way. Small superficial mass, 2 o'clock left breast.